We do contract with several other insurance providers. If you are still receiving benefits under Blue Cross Blue Shield, St. Lawrence Lewis BOCES, St. Lawrence County Resolve, or POMCO. These are all insurance companies that we have contracts with as well. If you're still employed or you're still working and if you have these insurances as your primary insurance companies. So we just need to call for a prior authorization. That's all we would need to do. Any other questions about insurance?
Do you call or do we call?
For prior authorizations, the admissions coordinator does the phone calls to set up the prior authorization. Yep. Good question. Any other questions about insurance? We could go on all day about this, but I gave you guys the Reader's Digest version. Moving along to discharge planning. All right, you've made it. It's time to head home. You've been with us now for 2 weeks. You're doing really well. You're using a cane now to get around, and you're that much closer to making it back to your home. So what do we do for discharge planning? We don't just send you out the door and say, good luck, best of luck to you, hopefully we don't see you again. We have 2 social workers at our facility, and their primary job is to make sure that when you're discharged, that you are successful for making your transition back home. We set up primary care physician follow-ups for you, with whomever your primary care physician is. And while you're with us, our medical director at either facility, at RiverLedge is Dr. Dunn, and at Maplewood is Dr. Healy. They're in constant contact with your primary care physician during your time with us to make sure that your own your personal physician knows what's going on with you while you're at our facility. That's really important to us. Prior to leaving, we also make sure that you have all of your discharge prescriptions. You may be on a new medication now for a little while, or you suddenly have been diagnosed with high blood pressure and now you're on a blood pressure medication. We want to make sure that all of your medications are ready for you when you leave Maplewood or RiverLedge, so that when you get home, you can be successful. Outpatient physical therapy referral. Now, both of our facilities do offer outpatient physical therapy, Maplewood and RiverLedge. They're both in the same areas of the facilities, so our therapists are actually in kind of the same office area, so they can communicate about what your course was while you're with us during inpatient therapy. So both facilities do offer outpatient therapy. If you are in need of additional therapy, we'll make sure that referral is made. If you're struggling a little bit more before you're discharged or when you're discharged home, we can also set up home care for you if you need just a little bit of extra assistance in the home, whether it's housekeeping or you need somebody to come in to help you with getting dressed in the morning for just a short period of time. We can help and assist with getting that set up. And any sort of assistive devices that you might need. If you need a walker or a cane or this really neat little device that occupational therapy gives you to help you get your socks on. So we make sure that you guys have all of these devices prior to being discharged.
Help split wood and file wood.
I don't know. Justin's the new admissions coordinator, so you can talk to him about that. Depends on how many cord you have. Good question. So to move along here, just a quick video. This is Trent Warden. He was our physical therapist at Maplewood for a little while. He's now the physical therapist at RiverLedge. But the purpose of this video is it talks a little bit about the importance of going to rehabilitation after having surgery or having a joint replacement, especially. It also gives you a little bit of a view of what our therapy center looks like at Maplewood and what the rooms look like too. So not only can you see it now, but also when you set up your tour. Bear with us.
We work with each resident with whatever their goals are. We got to work on their mobility. We need to get them as independent as possible to go home. It's very patient-oriented, resident-oriented. Every resident has different goals. We see a wide range of diagnoses. We really leave it up to the resident when they're able to come. We're flexible as far as when they come. Some residents do better early in the morning, some do better in the afternoon. We want the resident and the family members to be very involved in their care. We like to set up family meetings before they end up going home. And we really talk specifics about their home and what they need to be successful. So, if they need an assistive device which they didn't have before, we can get that equipment for them before they go home. We want to make sure if they need any further rehab that maybe they can go for home care physical therapy. We want to make sure that is ordered before they go home. We want to make sure everything is set up prior to them going home. If they need Meals on Wheels, if they need Lifeline, we want that set up before they go home. Our family meetings are a good opportunity to get all that started. Our ADL suite's a great place to make sure they're safe. We bring them through our kitchen, make sure they can get the plates out of the high cupboards, the bowls out of the low cupboards, get something out of the fridge and transport it to this counter. Things they would have to do at home, which while they've been here they haven't had to do. We want to make sure they can get in and out of a bed without railings. Little things like that, where once they're home, they don't have all the assistance that they have when they're here. So the benefit of coming to rehab would definitely be, you get all your meals provided, you get all your medications provided on time. You're also provided more therapy than if you were to go home. We provide up to 2.5 to 3 hours of therapy, depending on what the resident can tolerate. And if you go home, you're probably going to be seen 2 or 3 times a week, and your time is somewhat limited. You come to a rehab facility, you're absolutely going to be provide as much therapy as you can tolerate, and really strive to get you to progress to your goals and to go home.
So the choice is yours. As I said earlier, we'll be asking you guys some questions about your own personal living situation at home and things to keep in the back of your mind when choosing your follow-up after surgery. Inpatient therapy isn't for everybody. It's really based on your needs. So some things you want to keep in mind are do you live alone? What floor do I live on? If all of your bathroom's up on the second floor, your bedroom's on the second floor, are you going to be able to go home directly from the hospital and make it to the second floor so that you can bathe or sleep in your own bed at night? Those are things that we can work on in the inpatient setting. Can I manage on my own? Can I make my own meals, get dressed, do my own shopping or errands? All again, things that we can provide for you at the facility. Or if you have friends that can help you out, maybe outpatient therapy is the route that you want to go. So it's really based upon your own needs and your own preferences. I'm almost done, I promise. Is there any questions, any other questions that came up as we were going through the presentation, or how we receive referrals, or any questions that you have about your own personal situation and what maybe our recommendation would be? You can always come up and ask me afterwards too, if you have a personal question. So, all right. Well, I want to thank everybody for coming this afternoon on behalf of the United Helpers Organization. This educational series is a part of our continued commitment to the New York State Department of Health DSRIP, or the Delivery Reform Incentive Payment Program. This program is designed to engage and encourage residents of St. Lawrence County to learn more about healthcare options that are available. DSRIP is an initiative designed to reduce avoidable hospital visits by 25%. And our focus is on education, prevention, and high-quality healthcare. So again, thanks so much for stopping by. Please help yourself. Yeah, sure, come on up, Kim. Help yourself to some cookies and coffee. And I just want to take a quick second here to introduce my boss, Kim McFadden. She's the administrator at Maplewood.
Hello. Thank you.
Nice to meet you. I'm so glad you came out. It's great information. It's often difficult for us to get this information out to people before they're in a situation where they're in need.